How are you all? I hope you are doing good, guys. Okay, so how are you all, guys? All great. So let's start. Let's not wait much. So, guys, I again, welcome you to this webinar today on the vaccine science and immunotherapy. And I can see Dr. Neha has also joined. Hi, Neha. Good
Hello.
evening. How are you?
Fine. Good evening. Good evening, all.
Guys, yes, I welcome you all guys to this webinar, which is on immunotherapy and vaccine science. And here, this is an introductory webinar. And why we are conducting this is, a very special day. Again, I'm telling you, this is not the vaccine day, but we are coming up with a fantastic course, which is a very short course of 4 days on the same topic, vaccine therapy, vaccine science and the immunotherapy. Okay, and that is starting this weekend only. Okay, the course is starting day after tomorrow on 9th. Okay, the course is starting on 9th. And let me share with you, if you have not registered, many of you have registered already, and this course is going to be very great and amazing, because as we have seen in the corona time, everyone was struggling about the vaccines, how the vaccines are being developed. So and how the immunotherapy and the immune science work in that. So, looking into that only, we have come up with this short course first, and we want to explore this area with you all. So, this webinar today is to discuss, one of that topic. And if you are left behind, because the day for the registration, last date for the registration was, the 5th of May. Okay. But still on the request, and as we are conducting this webinar, so if you have not registered yet, we are giving this opportunity to all of you. If you wish to register, you can register for this 4 days program. So this 4 days program is on vaccine science and immunotherapy, and it will be from 9 to 12. Okay, 9 to 12 May. It's like Friday, Saturday, Sunday, and Monday. So this course will be on these 4 days, and every day evening from 7 p.m. to 8:30 p.m. Okay, from 7 p.m. to 8:30 p.m. every day it will be. So it is at your convenient times. But why, we thought, like, we already have many students in this course, but why we thought of this conducting webinar? Because see, we want all of you to understand, and all of you to, come to this fantastic course and join this, with us. So you can see here, you all are eligible, and you can see what we are teaching in 4 days. In 4 days, we are teaching almost everything. First, about the vaccine science, immunotherapy, and then, so in this you will get to know immunotherapy and introduction to the vaccine science today itself, and that will be repeated in the course as well. And in the course, additionally, in the lecture 1, you will be getting latest developments in the vaccine science, including mRNA vaccines beyond the COVID-19, and influenza vaccine and all. And then immunotherapy in the disease treatment will be taken care, all kind of CAR T cell therapies and checkpoint inhibitors, and you have heard of monoclonal antibodies. So those, everything will be covered in this. Okay. And then the special thing, role of pharmacist in vaccine science and immunotherapy, as most of our students are from PharmD background and BPharm background and MPharm background. So they are the pharma and medical scientists. So this course is very much suitable for them. And then you will be learning about the future trends, like, we talk about the diabetes medicine, diabetes vaccine, and we talk about the cancer vaccines and combination therapies, multiple things, right? So in this course, you are going to learn about this. The course cost is just 499 rupees for 4 days, and it is starting from 9th. And we have with us the instructor, our instructor, Dr. Neha Srutia. So you all know her, because she has already taken the 4 days course on pharmacogenomics, and she is taking the 2 courses right now on the pharmacogenomics, but which is, and personal medicine, which is 4 month certificate course, and she is also taking the master certificate course in antimicrobial stewardship, right? So many of you are there already. So if you wish to join this course, please join us with this wonderful course. So let me tell you a little bit about Dr. Neha. So Dr. Neha is a definitely distinguished healthcare professional, and she has done doctorate in pharmacy, PharmD, and has the extensive expertise in clinical and pharmacy practice. She has worked as assistant professor at Parul University, and she has demonstrated a profound commitment and research as academician. And she has authored one very fantastic book also. If you get time, you please read it. If you have not read it, the book name is Drug Related Problems and Their Overcomes. Okay, and she has contributed to the science community with 12 publications in international and national journals. She has delivered the lectures and participated in several conferences, webinars, workshops, and panel discussions. So and she has been working in the COVID-19 crisis as the volunteer to serve the humanity in Dheeraj Hospital, and a lot of things to discuss about her. So guys, uh, you know uh, before that, before I hand over the mic to Dr. Neha, I request all of you to join this course. If you are interested, please come and join this course and learn with us. Okay, and yes, one very important thing I want to discuss with you. So you all will be on mute. You cannot open your mic, and you cannot also text in between. Okay, so considering the past events in our online webinars, so you all will not be even able to send the messages in between. Okay, so you can send the messages at the end. You can open the mic at the end of the webinar, and you can talk. You can ask your questions. You please keep your questions with you. You can ask your questions at the end of the webinar. You can write your questions at the end of webinar. Your mics will be open. You can talk to her directly. So you will get your time, but in between, we will not allow any kind of communication. Okay, so guys, with that, I will hand over the mic to Dr. Leah Sorotia. Thank you very much for joining, guys, and again, come up with the many questions at the end. So over to you, Dr. Neha. Thank you very much for joining.
Thank you. Thank you. Thank you so much, sir, for the introduction.
I think
And
you are not audible, Neha.
am I?
One sec. One sec.
Yeah, I think.
Now, please unmute yourself.
Okay, the host setting, I think.
No, no,
Yes.
no. You are not audible. I think there is some problem. One sec. Yeah, you are audible. Yes, please speak.
Yeah. Am I?
Yes, I think you were not audible to me
Okay.
only. Yes, 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 yes. I'm so sorry.
Okay.
I think my device was connected to Bluetooth. Yeah. Okay, now it is. Okay, please.
Okay.
Yeah, please go ahead.
Thank you. Thank you for the introduction. And once again, I welcome you all to this, wonderful webinar on vaccine science and immune therapy. And I'm truly delighted to see such an enthusiastic turnout today. We have 189 participants today, reflecting shared curiosity and commitment to understanding one of the most dynamic and impactful field in the modern medicine, which is vaccine. See, this is very important and this is very interesting to learn how vaccine works because it actually saves lives. And
We
after
have
COVID,
many, I'm so sorry to interrupt. We have many on YouTube also. It's on YouTube Live as well.
okay. So, yeah, I was talking about the importance of vaccines. So, before we proceed with the topic, we should know the importance of it, right? Because the why is very important to learn, because that makes you, more curious about the learning process. So, vaccines and immune therapies have not only transformed the way we manage the infectious diseases, but nowadays these concepts are playing an increasingly critical role in the cancer treatment as well as some autoimmune disorders, and even in shaping the future of personalized medicine. So, and we are, as a healthcare professional in the field of, healthcare, we should understand the importance of individualized treatment, precision medicine, personalized medicine, right? So, with the rapid advancement in this mRNA technologies, monoclonal antibodies, and therapeutic vaccines, it's an exciting time to dive deeper into this field. And that's the only reason we have come up with the course as well as the webinars. So today's session, I briefly introduce you and then we'll share the screen with all of you and we'll go through the PPT. But first of all, please understand the session's overview. So today's session is all designed to give you a solid foundation, basically an overview of how your vaccine works, how immune therapies are differ yet complement your vaccine strategies, and why this science is so crucial in global health and biomedical innovations. Okay, so we'll see the importance of learning vaccine science. So whether you are a student, researcher, or a healthcare professional, or simply someone who is passionate about science and public health, I hope this session sparks your interest and opens the new avenues for exploration in vaccine science. So we have engaging sessions ahead. So also I would like to request you all to, as sir already told, but I want to repeat again that you can ask question at the end of the session. Please ask as many as questions, so we'll make it interactive webinar at the end of the session. Okay. Without wasting much time, I will be sharing screen with all of you. I hope the screen is visible.
Yes, make it full screen. That's all. Yeah, perfectly fine. Please go ahead.
Okay, so our lecture title is itself unique, unlocking the power of immune system. So we'll understand what is the importance of our immune system. Everyone, I think, have idea of immune system, basic, right? But what vaccine has, impact on immune system, how it is, stronger, making stronger your immune system and recognizable the memory cell, that we need to understand in today's session. So basically, this is an introduction to vaccine science and immune therapy on, brief level, right? So we'll start the course. Okay, so what will be the learning objectives for today's learning? So we'll understand the science behind vaccines and immune therapy, first of all. Then we'll see very interesting part, that is real world success stories, because that sparks our interest in the subject. When you see the practical implementation of our theory, and when you see your practical, where you can be a part of practical scenarios, where you can make yourself aware of vaccine science and immune therapy and actually implement in your daily practice, that you need to understand based on real world success stories of vaccine. So I won't be covering the historical part of vaccine, कि कहाँ से शुरू हुआ और कौन से ईयर में वो शुरू हुआ वैक्सीन, वो वगैरह नहीं देखने वाले, because that is not as important. But you need to understand some of the real world success stories to understand the importance of vaccines, because nowadays medicine it's alone cannot do wonders, right? So we all have gone through the very big challenge COVID-19, and we were facing second wave too, right? And that was very crucial part of our whole lives, and that's where we understood the importance of vaccines, right? So that's the only thing, and the future, I think, held many of things further, and will be holding many of the things. Many of the diseases are coming up, many of new bacteria, viruses are coming up, and as a healthcare professional, we should be aware of vaccine science, whether you are of pharma background or not, but you should be aware of science behind vaccine. Okay, so that's the only objective. And the last, we'll see how these innovations are changing the current flow of medicine. So where we are shifting, okay, where we are shifting from to. So those are the learning objectives, clearly defined and understandable learning objectives for today's webinar. It will be very simple, but your why will be stronger after the webinar completion. Okay, so you will be able to understand the importance of vaccine, nothing else. Okay, so that is the overall summary of today's session. Let's get started. So we'll start with the very basic things of immune system. So we'll start further with the very root of vaccine, because vaccine has a direct role on immune system. It makes aware, your immune system is, itself making themselves aware, and your memory cell will be there, that is, having the holding the memory of your foreign material. Basically, that is the overall concept of vaccine. I think everyone has minor idea of what is vaccine. Maybe some of you have idea that is the killed bacteria, or died form of bacteria, or inactive form of bacteria, which is getting inserted into human body, and human body makes antibodies against it, एंड मेमोरी सेल बनते हैं, मेमोरी सेव होती है, एंड फ्यूचर में जब वो इन्फेक्शन रिलैप्स हो तब वो चीज काम आती है. सो दैट इज द ओवरऑल कंसेप्ट ऑफ वैक्सीन, बट विच इज वेरी बेसिक. वैक्सीन बहुत कुछ डीपर अंडरस्टैंडिंग में है, एंड मेनी ऑफ द थिंग्स आर देयर विच इज इन द रूट ऑफ वैक्सीन साइंस. सो विल स्टार्ट फर्स्ट विद द बेसिक्स ऑफ इम्यून सिस्टम. So we'll start with the overview of immune system. So we first have the definition of it, which is very simple and understandable. The immune system is a complex network of your organs, your tissues, cells, and substances. Now, see this, the all of combined work as immune system, right? Those all are working together to protect the body from infection and disease. That's where it comes the immune system word. Okay, system means all of these are working together, and it recognizes and eliminates harmful invaders, whether it is bacteria, viruses, or any kind of fungi infection, as well as some abnormal cells like the cancer. Okay, so that is abnormal growth of the cells, or some toxic chemicals, toxins, etc., that can be, we can say, uh, flushed out from the body. Okay, so that is the actual role of your immune system, where we have one good diagram to understand this concept. So when it comes to immune system, you have all of these organs, like it includes lymph nodes, it includes appendix, bone marrow, right? We have spleen, thymus, and many of the things are there. So basically, it covers all of your organ, tissue, cells, and substances to work together to protect your body from the immune system. And that's where your target of vaccine will be. Okay, so that's the only thing we are starting from the root basics of immune system, so that you can better have idea where your substance or where your chemical is going to be act. Okay, so this is the overview of immune system, which is very simple. Now, what will be the key concept of your immune system? So in immune system, if we are having the theory of immune system, the very two words that come in our mind, that is innate and adaptive immunity. Now this is also very, very, very basic, right? Because I think in a very bachelorate level, we have understood this innate immunity and adaptive, as its name suggests, innate and adaptive. Okay, I will see the definition of it, do not worry. But these are the key concepts. Okay, so we have innate versus adaptive, and apart from it, we have antigens, antibodies, and memory cells. Okay, so we'll see one by one what are they and how they are having impact on immune system. So these are the two arms of our immune system, we can say, and these are innate and adaptive immunity. Now, very important to understand is innate immunity is the body's natural and non-specific defense system that is present from the birth. Innate, as the word suggests, it is a body's natural non-specific defense system that present from the birth itself. So it is the first line defense against foreign substances, we can say, and this providing a rapid response to the threats like bacteria and viruses. So basically, innate, the speed will be immediate, minutes to hours. While on the other hand, we have adaptive immunity, which is a specific and long lasting immune response that develops throughout the life. So there will be many of the factors which are affecting adaptive immunity based on person's lifestyle, based on another things. Adaptive immunity may vary. Innate will be from birth, adaptive throughout life the person develops. So basically that requires days to week, the speed will be slow. Okay, adaptive immunity providing protection against pathogens and enabling the the body to recognize further and response to the future encounters for the same threat. So that is our concept of adaptive. So यहाँ पे क्या है, बॉडी के जो मेमोरी सेल है, इम्यून सिस्टम के जो मेमोरी सेल है, they have memory specific quality They will remember the antigens and they will make the antibodies and they will store it for the future relapse. That is adaptive. Now you can imagine where your vaccine will be, working on innate or on adaptive, right? So that is the only concept. I want to relate all the things about vaccines. So I'm starting with the very basic thing about innate and adaptive because we need to understand this two concept. Okay. Then we have a feature called memory. So from birth, innate immunity, there will be no memory associated with it. But for adaptive, that has memory faster upon the re-exposure. Basically, it is effective on relapse condition. Okay. And another feature we are having, that is key components which are involved. Now, key components in innate immunity, we have skin, we have mucous membranes, we have phagocytes, and on adaptive immunity, as a key components, we have B cell, T cell, and antibodies. Now, you know, B cell and T cells are the soldiers of our immune system. Okay, without them, we cannot fight against infections. Okay, so we have another cells also like dendritic cells, etc., to make the specific type of response. So when your antigens, whether it is bacteria, specifically bacteria which invade into the human body, your dendritic cells are the one which are acting as the antigen presenting cells, APC. Antigen presenting cells, dendritic cells are working as APC, which are responsible to present the specific antigens further, by traveling through the lymph node system and then present to the T cell. Okay, and T cell, again we have two different types, T4 and we have a CD4 positive, and we can say CD8 positive, which is cytotoxic cell, right? Helper cell will further help to convert your B cell into plasma cell. Okay, that's the only reason why they are knowing as the helper cell. B cell will convert into plasma cell, and plasma cell store your antibodies, which is released from the plasma cell. Antibodies plasma cell में बनती है and वो which is nothing but the B cell का एक swollen form. Okay, so basically B cell एक swollen form में convert होता है, which is known as plasma cell, and by the help of T helper cell, which is getting converted and antibodies further released. Now that is the whole concept of your adaptive immunity. Okay, and these are the parts of your adaptive immunity. So you have to understand these two arms of immune system, very basic level pe, innate immunity and adaptive immunity, right? I think it is understandable. Okay, so simple analogy is innate is like a security guard, quick response to any invader or intruder. Adaptive like a trained detective, identifies, remembers specific criminals. So basically, just you have to remember by this sentence that adaptive immunity requires time to to generate the memory, and then they will come up with in the future to for the defense. Okay, so this is how the simple you have to remember the innate versus adaptive. Okay, now the second important concept to learn before we jump into vaccine science, that is the key players in the adaptive system. Now this is also very important to understand. We have antigens. I hope you have the basic definition of antigens, which are the foreign molecules like a part of your bacteria or viruses that triggers your immune response. Antigens. Okay, B cells and antibodies. B cell produces antibodies which are like guided, we can say, missiles which are targeting your specific antigen. Antibodies, right? Which are basically target specific, antigen specific, we can say. For example, after COVID-19 vaccination, B cell make antibodies against the spike protein. Now, spike protein, I hope you know the spike protein definition, which is also known as a papillomer protein. I have included the another slide to understand the structure of spike protein, so do not worry. But when it comes to vaccine, you have to remember this specific name, okay, spike protein. So we'll understand further what it is. Just understand here the key players in adaptive system. On one hand, we have antigens, foreign materials, and B cell antibodies, which are acting as a soldier. Next, we have T cells. I already explained you there are two types of T cell, helper cells and cytotoxic. CD4 positive act as helper, CD8 positive cytotoxic. CD4 positive coordinate your immune response. Coordination में क्या होता है? That is helping to convert your B cell into plasma cell to make more antibodies. And the specificity of this T cell is very interesting actually. Whenever your dendritic cells act as antigen presenting cell, which are coming from the environment, and when this APC, which is antigen presenting cell, presents your antigen to this T cell via your MHC complex, then and then this T cell gets activated. Now this is the complete whole different topic to discuss, pathophysiological part of understanding immunity, so I'm not going in detail about it, but you just need to understand that your T cell is getting activated by the presentation which is made by antigen presenting cell, फॉर एग्जाम्पल डेंड्राइटिक सेल, एंड वो कौन से कॉम्प्लेक्स के थ्रू प्रेजेंटेशन होता है, सो वो होता है MHC, major histocompatibility complex बनता है, which is also having two types, 1 and 2, and then your T cell is getting activated, where CD4 positive helps further to make your antibodies process easier, so that they are having the name of T helper cells. Another part we have, that is cytotoxic CD8 positive, that kills your infected or cancerous cells. Sometimes the CD8 positive are responsible for their own cell killing, like healthier cell killing के लिए भी sometime ये responsible होता है, where the concept came autoimmune disorders. Okay, so we'll discuss further in detail what it is, but just understand these are the key players in adaptive system. Another we have very important in our vaccine concept, memory cells. So once your antibody is done, formed after infection or vaccination, so once the infection is cured, then also memory cell will be there, and after vaccination also memory cell will be there. Further enable a quicker and stronger response upon re-exposure. So whenever the condition like relapse occur, this memory cell will have a role to play. So for example, after chickenpox infection, memory cell prevents reinfection for whole life. So that is the importance of memory cell. Okay, so these are the key players and where our vaccine has immense role to play. Okay. Okay, let's understand further what comes next. So, as a healthcare professional, we should understand that how this vaccine use this system, immune system. Okay, so vaccine कैसे काम करता है इस immune system पे, and how vaccine has role to play for this key elements. So vaccine introduce a safe version of pathogens. Safe version is a very important keyword here, that introduce a safe version of pathogens, basically killed, weakened or synthetic parts. ये जो bracket में लिखा हुआ है, that actually makes your vaccines into subtypes. Okay, vaccine के बहुत सारे types है, we'll discuss further in this webinar, types of vaccine. So whether your pathogens are killed in nature, weakened in nature or synthetic parts are given, basically that defines your type of vaccine. Okay, so we'll discuss this too. Basically, vaccine introduce safe pathogens, safe version of pathogens, which is specifically safe for the human body. That is introduced into the system, and body responds as if it's infected. So that after vaccination, sometime patient might have fever, rash, etc., for some time, and then it, he or she is getting recovered after it. But उसके साथ साथ क्या हो जाता है? They make antibodies, they build antibodies, and they build memory cells as well. Okay, so vaccine introduce safe version of pathogens and body respond as if it's infected, builds antibodies and memory cells. So if the renal infection happens later, so if your real infection happens later, your immune system neutralize it fastly before before the symptoms appear, basically. So that is the concept of vaccine on immune system, which is very basic and understandable. Okay, so this is the mini case highlight to understand the practical scenario. So after receiving hepatitis B vaccine, this is a very common scenario to understand. Okay, hepatitis B vaccine, which is basically a recombinant protein. Your immune system remembers the virus first, and if you are exposed years later, you likely won't get sick. That's the only reason hepatitis का vaccine अभी childhood से ही दिया जाता है, which is basically to prevent future exposure of this particular virus. That's how your vaccine has role on immune system. See, this is very basic because we have started from very introductory things. We'll, having the overview of it. This is very simple to speak and to listen, but these concepts are, when it actually, in a practical way, this is a very complex process. So we'll understand this. See, now we'll understand what are vaccines and we'll understand the mechanism of it. So, a vaccine is a biological preparation. Another keyword here, biological preparation, because it is synthesized in laboratories. Okay, so it is a biological preparation that trains your immune system to recognize and fight against specific pathogens without causing disease itself. That is a simple and understandable definition of vaccine, and this is the introduction of vaccine science. Okay, as I earlier said, there are types of vaccine, which is very important to understand. Types of vaccine. See, we have very first live attenuated. For example, MMR. MMR stand for measles, mumps, and rubella. Okay, and these three of them protected by one single vaccine, which is having type of live attenuated. We have another slide to have a description of this type, types. So that includes the examples, features, and definition of each of the types. So do not worry. Just see the names here. We have another type of vaccine. Actually, MMR के बारे में और भी एक चीज है. Actually, it is, typically given into two doses. First dose is for 12 to 15 months of age, and second is 4 to 6 years of age, which is compulsory by the government. MMR, right? Very important vaccine to understand. Okay, next type of vaccine we have inactivated, for example, polio. Next type, we have mRNA based vaccine. For example, Pfizer BioNTech COVID-19 vaccine का जो type आया था, which is mRNA, novel category में आता है ये type vaccine का. Novel, basically, it is new, and we can say a new generation of vaccine is coming. mRNA, right? And we have subunit and vector type of vaccine as well. Another types are also there, but these four are basic, and these are very primary types of vaccine based on which kind of pathogens are inserted into the body. Okay, let's understand the types further. So first we'll understand how vaccine works, and then we'll go for the types of it. So basically, that introduce a harmless version of pathogens as a whole part, or in a smaller version. For example, the part of bacteria or a part of virus. Further, it stimulates your immune system, produces antibodies and memory cell, and upon a real infection, the immune system responds faster and stronger. That we already understood. And this is the very good diagram to understand your theory from schematic presentation. So basically, weakened or dead disease bacteria introduced into the patient, often by injection. Okay, vaccine हमेशा injection के through दिया जाता है. Various routes are there. Okay, so you can have the look on the image. Then second part, white blood cells, okay, that are your soldiers, triggered to produce antibodies to fight the disease. You can see here they are making complex with it, and they are running on the making antibodies. If the patient encounters the disease later in the future, your antibodies neutralize further the invading cells. So that is how your vaccine works simply. Now, these are the types of vaccine I was talking about, and this is very important topic to understand if you are learning vaccine science. So we have live attenuated first. The description is very clear. For example, we have understood MMR, that is measles, mumps and rubella, and yellow fever के लिए जो vaccine दिया जाता है, those are having type of live attenuated. The description is weakened form of the germ. So weak form of pathogen, not killed. Okay, weakened form of the germ, inactive form of your whole bacteria or virus that can be inserted. Then it will be having type of live attenuated vaccine. Very simple. Next, we have inactivated type. Basically, the name itself suggests killed version of your germ. And that has example of your polio, the IPV, that is inactivated poliovirus vaccine. IPV, inactivated poliovirus vaccine. Another example, we are having hepatitis A, okay, which are the form of inactivated. Third type of vaccine we have subunit or protein based. Okay, protein based. So protein based से आप याद रख सकते हो only a part of your germ, basically antigen. एंटीजन से ही बाउंड होता है. Okay, there is always a lock and key mechanism over there. So protein based meaning only a part of your germ, for example antigen, that can be inserted, and that is your type of subunit, because whole unit is not getting inserted. Okay, a part of it, of the germ, is getting inserted. So that is how the name suggests, subunit or protein based. We have example, hepatitis B and HPV. HPV stands for human papilloma virus vaccine. Human papilloma virus vaccine, HPV. Okay, these are having types of protein based. Next, we have type of vaccine, toxoid. Now, these toxoid vaccines are a type of vaccine that protects against diseases which are caused by your bacterial toxins. So, I hope you have idea that bacterial cell wall release n number of toxins, okay, which are responsible for mediating the inflammatory process in the body. Okay, they are acting as a mediators of inflammation, and then it's come to the symptomatic, symptoms are there because of toxins is released by the bacteria. So basically toxoid type ki jo vaccine hai, that is inactivated toxin from bacteria is getting inserted. Inactivated toxins, okay, which are responsible to cause the disease condition. For example, we have diphtheria. Diphtheria ki jo disease ki vaccine hai, which has a type of toxoid. Diphtheria, I hope you know, a serious contagious bacterial infection it is of the nose and throat. And tetanus is very popular vaccine. Okay, tetanus has role toxoid type में fall होता है. Right. Next, we have viral vector. Now, this is specifically for virus category. As its name suggests, viral vector. I hope you remember the structure of virus, which is again very basic. From 12th standard, we have understood the structure of virus, right? And that has vector inside it. Okay. So basically viral vector type that uses a harmless virus to insert further. And in that category, we have example of J&J COVID-19. Okay. So very popular, our own vaccine, COVID-19, Johnson and Johnson COVID-19 vaccine, J&J, and also Ebola. Ebola is also a popular virus that can be cured by the vaccine. Both has a category of viral vector vaccination. Another we have that is mRNA. As I earlier said, mRNA is a novel, new to the technology. Okay. So basically that teach your cells to make a viral protein itself. Okay. Very interesting actually. And in our long 4 days course, we have included the understanding of mRNA, because I have more interest in learning mRNA kind of vaccine, because it is completely new to our world, and that has many of the invention further, where many of the research are under pipeline. And that, see the description here, that makes you curious about understanding of mRNA vaccine, right? Because that is teaching cells to make a viral protein itself. Okay, so basically that is very interesting to learn. And we have example again, COVID-19 vaccine, Pfizer Bartek ka, and we have another Moderna also is a COVID-19 vaccine, which is under the brand, I think you are aware of it, Spike Vax करके एक brand है, which is coming up with the COVID-19 vaccine. They have collaboration with the company Moderna, so the vaccine name itself, it is the Moderna. So basically that is how the types of vaccines are there. As I earlier said, the category of your pathogen which is getting inserted into the body, that's defined type of vaccine. Because sometimes every student has the answer of types of vaccine, but based on which, that they don't know. Okay, so many of time in Viva also, as we ask that say the types of vaccines, they have live attenuated, inactivated, toxoid wire, but how they are defined, no, description is not clear in the head, concept clarity isn't there. So that's the only reason you need to understand based on which category your vaccines has different types. Okay, which is very important to learn. I think it is clear now, so we can proceed further. So simple analogy again to understand, live and inactivated, both live and inactivated, showing the whole enemy. This is very interesting to learn actually. Your live attenuated and inactivated, meaning the some part of your germ and the killed part of your germ, that's showing the whole enemy, dead or weakened version. But your subunit, basically your protein specific, or mRNA, which is the novel or a new, that showing the wanted poster of the enemy. As I earlier said, these are new to our technology. Basically, we need to show them these are the antigens you need to attack. Okay, so this is how the difference is written here, and you just have to remember that live and inactivated जो type है vaccine का वो बहुत साल से चलता आ रहा है. Okay, but this protein specific mRNA is something new, and it is required to show them what wanted posters, meaning what are their targets basically. Okay, so this is how the simply you can differentiate the types. Let's understand further. These are also the diagram to understand your I have included to understand the conventional platforms and the novel platforms. Whatever types of vaccine you have understood, this is how it is differentiated. For example, live attenuated viruses, whole inactivated viruses, वायरस लाइक पार्टिकल, ओके, एंड प्रोटीन सब यूनिट, ये जो टाइप्स है वो कन्वेंशनल प्लेटफॉर्म पे आते हैं, बहुत साल से चलते आ रहे हैं, वेरी इफेक्टिव इन मेनी ऑफ द डिजीज कंडीशन. ओके, on the right hand we have novel platform. Novel means new. Okay, new platforms. For example, non-replicating viral vector, this is new to our era. Replicating viral vector, both has very thin line difference in the technology. One has non word inside it and second one is a replicating. Okay, both has similar principles to perform, but different names are there. Then we have mRNA vaccine, जो कि COVID-19 का जो type है mRNA vaccine, and some of the very minor vaccines, DNA vaccines we are having. So those are the novel platform. Just to show you by this diagram, I just want to briefly introduce you to the platform which are traditional and novel. Okay, so this is how you can differentiate the technologies. Okay, so I also repeat again what is, I think मैंने पहले बताया था कि मैंने slides में दिया है what is spike protein, because when you are jumping on the concept of vaccine science or immune therapy, बार बार ये नाम आएगा. Okay, spike protein. So you just need to understand what it is. It is very simple actually. See, in virology, a spike protein or a papillomer protein is a protein further that forms a large structure, known as a spike or papillomer projecting. Okay, so basically it is a large structure, nothing else. Okay, from the surface of an enveloped virus. Envelopes virus की surface के ऊपर एक बहुत बड़ा large structure form होता है, which is spike protein. And the proteins are usually in nature of glycoproteins that are forming further dimers or trimers. See the schematic presentation so that you can have a better idea of. This is the example of actually SARS-CoV-2. SARS stands for severe acute respiratory syndrome. I am again repeating, severe acute respiratory syndrome, coronavirus 2, CoV2. Okay, so this is the structure of that virus. You can see here membrane के ऊपर there is a pre-fusion spike protein in a purple color. Okay, in red color we have post-fusion spike protein. So basically these are nothing but वायरस के एनवेलॉप के सरफेस के ऊपर एक बड़ा सा स्ट्रक्चर बनना, दैट इज द स्पाइक प्रोटीन. नाउ विल अंडरस्टैंड द स्ट्रक्चर schematically, so it will be very easy to understand where I am going to learn the concept of vaccine. And if I am saying vaccine is attaching with the spike protein, now you have image clear in the head where it is going to attached. Okay, so I hope the spike protein concept is clear. See this, we have a very interesting case to understand, and I hope you have the idea, because this is the real case study of your mRNA COVID-19 vaccine. As I earlier said, mRNA is the type of your vaccine. COVID-19 का जो vaccine आया था. So what is the context here? So basically context is your severe acute respiratory syndrome coronavirus 2 pandemic, where the millions of lives at risk, and mRNA vaccine tech rolled out in under a year. So in only a 1 year it is there. Now imagine live attenuated vaccine होती या फिर those were on the conventional platform, उसको time लगता है, right? They it needs time. But in on the another hand, we have on a novel category mRNA vaccine that rolled out in under a year only. So what happened? mRNA vaccine, whether it is from Pfizer or Moderna, that delivered a genetic code Okay, sorry, I think am I audible? Okay. So, what happened next? mRNA vaccine, for example, Pfizer and Moderna, that delivered a genetic code for spike protein. Now you know the understanding of spike protein, right? Our cells produce the further spike, train our immune system, and then high antibody response were done. So that was the overall concept of your mRNA-based COVID-19 vaccine. And what was the impact further? 95% effectiveness in early trials were identified that prevented hospitalization and deaths, and that validated mRNA platform for the rapid vaccine development. Now that is the biggest impact of mRNA COVID-19 vaccines. Okay, this is very interesting to learn actually कि mRNA science क्या कहता है. I think that I in our upcoming course I have included a whole lecture on just understanding of these concepts. Okay, so because when you talk about this it may include the whole one lecture to understand how these technologies are working, and it is my area of interest always to discuss this kind of category of vaccines, because this is very interesting and revolutionizing in our field of healthcare, right? So this is the biggest impact and the real case study of mRNA COVID-19 vaccine. So what is the takeaway? mRNA technology or tech now being adapted for flu as well as RSV. RSV stands for respiratory syncytial virus. For that also mRNA is being adapted, and even for cancer vaccines. Now that is very interesting because flu can be treatable, RS respiratory infection also can be treatable, but when it comes to cancer, everyone, अगर मैं बोलूँ कैंसर, सबके दिमाग में क्या आता है? Dangerous, right? Danger ahead. So basically if just have a thought that we have a vaccine for cancer, all type of cancer. Okay, so what will be the scenario next? So that is a very important thing to understand the vaccine importance, and mRNA, specifically mRNA vaccine concept in the cancer treatment. Okay, let's understand further. So we have another bonus example to understand the importance of vaccine. Again, we have malaria vaccine breakthrough. So again, for malaria, that challenge was there. Malaria kills over 6 lakh people yearly, mostly the children in Africa. Parasite is very complex, mutates very quickly. That is the challenge. And what was the outcome? Moderate protection was given, like 30 to 50%, but was a historic milestone. Combined with other tools like the net and anti-malarial for broader impact, that was the only outcome. But then we have come up with the RTS-AS01, which is a Mosquirix vaccine, which is known as uh, the very popular vaccine for malaria, which is first approved in 2021, and that targets Plasmodium falciparum. Plus, it uses a protein and adjuvant complex. Now, this is very important. This particular vaccine is a recombinant protein type, and which is designed to prevent malaria in children specifically. Okay. So basically, we have protein and adjuvant type. I have included in next slide what it is, the combination, how it works. So do not worry. But we have the example of RTS protein plus adjuvant complex. So the key message here is vaccines don't need to be perfect to save lives. They just need to shift the balance in our favor. Okay, so this is the example of malaria vaccine. Let's understand what is protein and adjuvant complex. So in the context of vaccines and immunology, protein plus adjuvant refers to a vaccine formulation. So it is nothing but what? A formulation where a specific protein antigen which is combined with the adjuvant. Adjuvant का मतलब आप समझ सकते हो, protein is basically combined with one another adjuvant to enhance the overall immune response. So it is getting combined with another agent so that you can increase your immune response. Basically synergistic effect you can say. So adjuvants are substances. क्या है ये? एक substance है that boost your immune system ability to recognize and respond to a particular antigen, leading to a stronger and more protective immune reaction. Now imagine if you are combining your protein with adjuvant, your your ability of recognizing and responding to antigen will be more. So that is nothing but a combination, and that's the concept of your RST वाला जो वैक्सीन है मलेरिया के लिए, that is the concept of protein and adjuvant combination. Okay, so that is also another example of your mRNA vaccine. Okay, so now we have come up with another concept, immune therapy. What it is? Immune therapy is a treatment specifically that uses your certain parts of immune system to fight against diseases, specifically cancers, chronic infections, and autoimmune disorders. Okay, see here, this is the very good example of कैंसर ट्रीटमेंट का पूरा इम्यून थेरेपी समझाया है यहाँ पे. सो बेसिकली ब्लड फ्रॉम द पेशेंट इज गेटिंग कलेक्टेड. So when you are getting blood, you will be having T cells, obviously. Then you are doing a reprogramming of your T cell. Reprogramming of your T cell. Basically, it is nothing but, for example, you are inserting something into your T cell. Okay. We have example of CAR T cell here. See here on the right hand side, reprogramming के बाद grow the population of CAR T cell. What do you mean by CAR? CAR is basically a gene. Okay, CAR क्या है? एक gene है which is inserted into your T cell. T cell में वो gene डाला जाता है to turning them into a CAR T cell. Now this CAR T cell is a nothing but a type of immune therapy where patients T cell are modified in laboratory to recognize and destroy your cancer cells more effectively. सो जहाँ पे ये कार जीन इंसुलेट किया जाता है, इंसर्टेड किया जाता है इन योर टी सेल्स after getting blood from the patient, then it is infused again in the patient, and then your T cell is superpower. Okay, T cell के पास सुपर पावर आ जाती है to eliminate your unwanted cancer cells. That is how immune, this is a type of your immune therapy. CAR T cell is a type of your immune therapy. CAR क्या है? एक gene है. Okay, one gene is there that is getting inserted into your T cell. So immune therapy is a treatment that use certain parts of your system to fight against diseases. Own therapy. Okay, so that is the overall concept of immune therapy, which you can understand by this example. Okay, let's understand further how it works, how immune therapy works. So it basically boosts your body's natural immune response, train your immune system to recognize and attack your specific cells like cancer, and restore your balance when the immune system overreacts. For example, autoimmune condition. तो ये तीनों चीजें करती है. ऐसा नहीं है कि सिर्फ बूस्ट करेगा immune response को, but it will train also to recognize, and it will restore balance also in case of overreacts, which is very important, okay, to understand. So analog is simple is, think of immune therapy as a precision tuning for your immune system. Either it is boosting, either it is redirecting, or either it is calming it down. So there are always a three ways. So in ये सारे जो है principles है immune therapy के, और immune therapy जो है ये सारे principles को साथ में लेके चलता है, right? So this is the overview of immune therapy. Major types of immune therapy. So this is a very good table to understand. We have monoclonal antibodies. Okay, we have included in our upcoming course these types of immune therapy, a whole lecture dedicated to this. Okay, this table to understand in detail about what is monoclonal antibodies. So basically these are lab made protein that binds to the specific targets. For example, we have breast cancer का जो बहुत अच्छा treatment है trastuzumab, but trastuzumab is only effective in case of HER2 positive. HER2 is a human epidermal growth factor receptor 2. Human epidermal growth factor receptor 2. In case patient को breast cancer है and HER2 positive है, which is genetic test, okay, तभी trastuzumab effectively काम करेगा. Okay, so that is monoclonal antibody. Next type we have checkpoint inhibitors. Checkpoint inhibitors, for example, that releases the brakes on T cell. Examples we have nivolumab and we have pembrolizumab, PD1. Now you need to understand what is PD1. PD1 is a protein which are found on the surface of T cell. Understand? T cell को imagine करो, उसके ऊपर एक protein which are found, which is PD1. Also, we have another type, PDL1, which is found on the surface of cancer cells. Okay, PDL1, which are found on the surface of unwanted cells, cancer cells. So when they bound together, this PD1 and PDL1, normal T cell के ऊपर एक protein है वो और कैंसरियस सेल के ऊपर एक सरफेस पे एक प्रोटीन है, वो दोनों का अगर कॉम्बिनेशन हो जाता है, देन इट इज लाइक अ ब्रेक, BRAKES, ब्रेक्स, ओके, ऑन द इम्यून सिस्टम, वेयर योर नॉर्मल टी सेल हैज नो इफेक्ट। तो आपके टी सेल जो है वो कैंसरियस सेल को मार नहीं पाएंगे। इन केस ऑफ CD8 पॉजिटिव वॉन्ट गेट एक्टिवेटेड, ओके, सो साइटोटॉक्सिक रिस्पॉन्स नहीं मिलेगा यहाँ पे। So that is how your checkpoint inhibitors are doing all the work. PD1, PDL1, right? Then we have another example, CAR-T. I think I already explained you what is CAR-T. CAR is a gene which is getting inserted into your T cell, makes them a super, powerful patient T cells to attack your cancer cell. We have a very good type again. We have all type, which is basically standing for B cell precursor acute lymphoblastic leukemia. Oh, you just don't have to remember the whole name. All is standing for leukemia, okay, which is very basic in child and young adults, okay. And we have lymphoma also. Example, CAR T cell therapy किस में काम करती है? Another type, very important type, cytokine therapy. Now, if you remember cytokine, cytokine is a mediator of inflammation, right? Cytokine therapy. Mechanism is using immune signaling proteins to stimulate cells. Okay, immune signal, as I earlier said, immune system ka part hai, and cytokines are responsible for your symptoms, right? Because it is a mediator of inflammation. We have 4 category of mediators, okay? Arachidonic acid का है, histamine है, cytokines है, chemokines है, right? Or complement proteins ka hai. So these are another thing to understand. But cytokine therapy use your immune signaling proteins to stimulate your cell. For example, interleukin 2 and interferons. If you understood your pathophysiology and if you remember the concept of it, these two are a part of your cytokine pathway, right? So basically, these are the example. And last, very important, cancer vaccine. Basically, that teach your immune system to target your tumor specific antigens. And we have example, HPV, okay, human papilloma virus vaccine prevention, which are trials are ongoing into it, and very important to understand the cancer vaccine. I briefly introduce you to the types of immune therapy, but trust me, it is more in detail, it is more interesting. As I want to discuss a lot of things now, but as the time restricts, I have briefly introduced you to the types, mechanism, and examples. But I cannot restrict myself to, giving you the more information about monoclonal, because monoclonal antibodies has immense role to play. Okay, so please remember this type of immune therapy briefly. Okay, what are the clarifying points here? We have monoclonal, like the heat-seeking missiles targeting cancer cells. I don't know why, while making this presentation, my minds are always thinking about missiles. Okay, because today is a very good day for us. So, okay, monoclonal antibodies like a heat-seeking missiles targeting the cancer cell, which is a clarifying point. Next point, we have checkpoint inhibitors, which are take off the safety brakes so the T cell attacks tumor. As I earlier explained, PD1 जो है T cell के ऊपर attached है, and which are responsible for what? T cell कैंसरियस सेल को खत्म करता है, ओके, बट कैंसर सेल के ऊपर PDL1 प्रेजेंट है, एंड व्हेन दे बोथ मेक कॉम्प्लेक्स योर टी सेल बिकम्स इनएक्टिव. So that is your checkpoint inhibitor. And CAR T therapy, like programming a body's internal killer robots. Okay, see the diagram. Schematic presentation is very important to learn the concept. Okay, how monoclonal antibodies work. So antibodies bind to their target, and you can see here the right side पे ऊपर जो picture है, once attached they make it harmless. Okay, so that is how your monoclonal antibody is working. How your checkpoint inhibitor is working. See the two of the diagrams. First left hand side पे जो है which is making inactivate, because आप देख सकते हो T cell and tumor cell के बीच में there is complex between PD1 and PDL1. PDL1 is present on tumor cell, PD1 is present on T cell. Both are making complex, so your T cell is becoming inactivate, cannot kill your cancer cell. Understood the left side diagram? I hope it is clear. Okay, and right hand side पे देखो immune therapy targeted. So what happens in that case? Immune therapy दिया गया है. So even if this complex is there, the complex is getting inhibited, blocked, okay, by your immune therapy. Immune therapy white color की आपको दिख रही है यहाँ पे, PD1MAB लिखा हुआ है, which makes your T cell activate enough to kill your tumor cells. चेकपॉइंट इनहिबिटर, चेकपॉइंट हमें देखना है कि टी सेल काम कर रहा है या नहीं. वेरी गुड टू अंडरस्टैंड द कंसेप्ट, इज वेरी इंटरेस्टिंग. एंड CAR T I already explained you. CAR-T में कुछ नहीं है, उसमें जो टी सेल है उसमें इंसर्ट किया जाता है द जीन विच इज एनकोडेड फॉर द स्पेसिफिक एंटीजन रिसेप्टर, ओके, which is basically then proliferate and making your T cell very powerful to target your cancer specific cells, which makes your cancer cell dies. Okay, so that are the killer robots. I hope these clarifying points are clear, which is very interesting to learn. Okay. So this is again, I hope this case makes you more aware, and there's my point behind this webinar, my whole point behind this webinar was only one thing, to make people aware of vaccine science, because बहुत casually लिया जाता है, बहुत granted लिया जाता है वैक्सीन को, और ऐसे भी दिया जाता है कि वैक्सीन जो है बनाते हैं जो लोग, वही उनके साथ डेडिकेटेड रहता है. We are not having any part in vaccine, but ऐसा नहीं है. It is more interesting. And see this real case study. This is very real. Emily Whitehead and CAR-T therapy का story है. And this is a powerful human story of science, survival, and breakthrough that makes you aware of the importance of vaccine. See, who? Emily Whitehead, the age is 6, diagnosed with all, that is acute lymphoblastic leukemia, had failed all the standard treatment. Okay, ये बहुत crucial चीज थी. What happened next? Doctor harvested her T cells, genetically modified them with a CAR, which is chimeric antigen receptor. Gene है एक, to target her cancer. Infuse them back. Massive immune response मिला. Complete remission हुआ. I have included the image of Emily. You will be surprised to know 10 years cancer free survival है उसका. That is the importance of innovation of CAR. See, outcome is Emily become the first child to receive CAR-T therapy, now over 10 years cancer free, and help driven global investment in the cell therapy. The key message here is immune therapy doesn't just support the immune system, it can transform it into a custom built treatment weapon. Okay, see the picture of Emily before and the picture of Emily now. This is the real story of CAR, and she was the first who received CAR-T therapy for cancer. Okay, this is where we are heading. Okay, so where this is going, rapid growth in personalized immune therapy, combining with AI, genomics, and mRNA technology. We are also on a very good course, pharmacogenomics and personalized therapy, right? You can, connect all those dots and make your patient, very specific with the treatment, individualized treatment, precision medicine, personalized medicine. You can have aim of those things. And what are the new frontiers here? So we have autoimmune disease regulation, transplant tolerance, viral infections like HIV. These are challenges to face. And what are the future? What are the, they can have a conversing fields. So the key message here is the future of vaccine science and immune therapy lies at the intersection of genomics, AI, artificial intelligence, synthetic biology, and nanotechnology, making therapies faster, smarter, and more personalized. That's what our aim is. Okay. And example of, we can say convergence, we can say genomics को आप immune therapy के साथ combine कर सकते हो. For example, tumor DNA sequencing that helps you to design personalized cancer vaccines which are more targeting your unique mutations. Okay. mRNA can be combined with your nanoparticles. mRNA vaccines are delivered using lipid nanoparticles, which are tiny carriers that safely reach your cell, cross the barriers also. Okay. AI and vaccine design. AI can also predict your viral mutations like flu or COVID-19 variants and speeds up your vaccine development. Microbiome, you can combine this technology with immunity. Your gut bacteria influence vaccine response and even cancer immune therapy success. See, ऐसे ही नहीं डाला है ये slide में. Each of this paragraph has examples. But as we have only 1 hour to finish it, so I am not included, I didn't included the examples of each of the category, but this is not hypothetical. Okay, ये hypothetically नहीं है. All of these are under pipeline. Researchers are having these things, inside their head, and they are working on it. And I want to want you to be a part of this kind of innovation. Okay, so this is very interesting actually. Okay, the final thought. Tomorrow's medicine won't just treat disease, it will train your body cell by cell to fight smarter in way. And the future is not one field, it's all of them working together. Whether it is genomic, whether it is AI, whether it is bioinformatics, whether it is nanoparticle, everything is working together. Okay. So, how these innovations are changing medicine? We have disease prevention beyond infectious diseases. So, we have traditional vaccines that have long helped prevent infection like malaise, polio. Next generation vaccines are now targeting non infectious diseases as well. We have cancer vaccines. We have vaccines under development. I hope you have idea that vaccines are under development for Alzheimer, for addiction, for autoimmune diseases. Okay, very important to learn this. These are the innovation further. These are very miscellaneous topics, so I'm just briefing you. Second, precision and personalization. So, immune therapy, especially in cancer, uses a patient's own immune system to fight diseases. We have checkpoint inhibitors. I hope now it is clear what is checkpoint, PD-1, PD-L1, CAR T therapy, cancer vaccines. These are tailored to patient's tumor profile specifically, and this represents a shift toward precision medicine, minimizing harm to a healthy cells and improving outcomes, right? And another, we have transforming cancer treatment. So again, in which we have CAR T therapies, and these are now becoming conventional therapies like chemo, radiation to improve a long time survival. Okay. Next, we have rapid vaccine development platforms. So the success of mRNA vaccines like COVID-19 that can demonstrated the speed. mRNA vaccine 1 year में ही बना है ये. So and adaptability also. Platforms that can be quickly programmed for emerging threats like flu, Zika, RSV. And this is a revolutionizing again how we prepare for pandemics and biothreats. Okay. These are emerging trends. We have expanding scope of immune therapy again for beyond cancer, you can imagine. Okay, now applied to autoimmune diseases like rheumatoid, multiple sclerosis, allergies, transplant rejection, and certain infectious diseases like chronic HIV, tuberculosis. And some new strategies include the tolerogenic vaccines to calm down your immune system. Okay, and engineered antibodies for passive immunity. So these are another emerging trends in vaccine science which are under pipeline, okay, which is coming next. Changing clinical trials and drug development. Clinical trials में भी उसका बहुत बड़ा role है, and drug development में भी. So there is immune therapy trials often require your biomarker testing for eligibility. For example, PD-L1. तो आप अगर PD-L1 found होता है, then what will be happen next? आपको predict हो जाएगा कि your T cells are not effective in that case. Okay. So these are biomarker testing, adaptive designs based on immune response data. Adaptive, I hope now the clear because we have started the chapter with the adaptive designs. Adaptive, okay, word. Last, integrating with genomics and AI. So AI and genomics are enhancing immune therapy. I hope you know the concept of genomics, okay? Because genetic is a traditional term, genomic is something new. Many of you might be have enrolled in the pharmacogenomic course, so you have better idea what genomic is. But let me tell you, it is recent mean 100-year-old branch. Okay, so integrating this with AI can help you again to identify the new antigens for your personalized vaccine, predicting your response and treatment resistance, and this can make you a customization therapies. Okay, so in summary, vaccines and immune therapy are no longer just about preventing diseases, they are about transforming how we approach, how we understand and treat the disease. They represent a paradigm shift from one size fits all to tailored immune based solution for a wide range of conditions. That is the importance of vaccine. To know more about vaccine, I think sir has already introduced you to the brochure, but if you found this course interesting, you can again jump and join us in this course, which is vaccine science and immune therapy. It is only 4 days, but I am very sure that you will be gaining a very insightful concepts of vaccine, which makes you aware that where the world is heading, where we as a healthcare professional are heading, and what is the importance of learning this concept. No one is talking about this, I think, and this is the only motive and aim of us as a climate family, that we need to brief you about vaccine. so that you can practically implement in your daily practices. Okay, so this is the course detail, this is the syllabus, you can check the brochure, and this is the miscellaneous part, the course details, so you can have idea what will be the course, and certification will be also there, which is helpful again. Okay, so thank you for joining. Now that is the most important part, question and answer.
Yes,
My
people have
part.
started writing the questions. Please go through, Dr.
Okay.
And if someone wants to speak, I'll just, yeah, you guys can speak also now. Unmute yourself and you can speak if you wish to. And you please write your questions here. And again, we are inviting all of you to register for this course. We are offering this course again only with that early bird fees only. PPTs, I'm not sure. Dr. Neha is here. Ask her.
Yeah, PPTs, I think you will be finding a YouTube video also, so there is no need of
Yeah,
PPT.
yeah, yeah. YouTube video is definitely there.
Yeah. Okay, someone is writing, can you please explain what CAR is? CAR is basically a gene which is inserted in your T cells to make it a super powerful that can resist your cancer cells. Basically, it is a technique of using immune therapy. How we tackle challenge against rapidly mutating viruses. Now that is the biggest challenge in case of vaccine, because virus mutations are unpredictable, but there are multiple ways to identify it before it is mutated, because there is certain patterns of virus that are ongoing. Okay, because see the COVID-19 का जो second wave था, the virus का जो variant था, that is predicted before. Okay, so that is how you can predict the mutating viruses. There are techniques. One of the staff suggested to take HPV vaccine to prevent infections. So is it safe? Any effect in the body? Is it completely safe? Vaccine जो कि अभी तक आ गया है, those vaccines are completely safe, and there is minor side effects of the inside the body. There is nothing else. Ma'am, what is the scope of PharmD graduates in immunotherapy? There is a vast course. As I earlier explained you in the slide, we have role of clinical trials and drug development in vaccine science. So there is direct link of PharmD graduates with vaccines, right?
Absolutely.
Can CAR T be administered right after birth to prevent? No, 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 no. That is not the correct way of using CAR T. CAR T is a very specific thing. If the person are diagnosed with certain kind of, cancers like leukemia, then and then the therapy option is there. Immune therapy का option है, ये पहले से नहीं दिया जाता. Very fantastic, but thank you for the appreciation. Always confused regarding HBV vaccine. What is the correct time to take the vaccine, after the infection or before the infection? Actually, for HBV vaccine, it is the correct time is before infection. But in case later also, it can be given by the certain physicians are preferring, because people are not vaccinated previously, then there is no way. Immune therapy to bone marrow transplant. Ma'am, how we more descriptive immune therapy to bone marrow transplant surgery? I didn't get your question. Can you elaborate? Wonderful presentation. Thank you. Thank you. Will there be any possible side effects with immune therapy drugs in cancer like chemotherapy? Yes, there are multiple things are there in cancer chemotherapy. The first and most important side effect, that it weakens your overall system, right? So that is the biggest challenge to face in chemotherapy. We'll discuss in upcoming our course what it is and how it is having impact. Discuss more about vaccine science and vaccine. My question is, how develop vaccines by the aid of AI and nanotechnology? Nanotechnology and AI cannot develop vaccine. It can suggest you ways of prediction. Okay, whatever agents are coming, and you can combine this technology with your existing technologies. So it can
Yeah,
be a synergistic way of deciding. That
and
cannot
usually,
make
yeah,
vaccine for you.
and usually nanotechnologies are for delivery.
Delivery, right? So you can combine these technologies, that makes your foundation very strong. Okay, alone, one technology alone cannot contribute vaccine making.
Absolutely. Okay, guys. So done all the questions, I think. Any other
Yeah.
questions, guys? Do you like to have any other questions?
What can be limitation in personalized mRNA vaccines based on individuals' genomic profile in chronic diseases like neurodegenerative disease, or see in neurodegenerative and cancer type of conditions, not all kind of mRNA vaccine is suitable, first of all, because patient's factor plays a major role in this. Okay. So if you found 10 cases of this kind of patient receiving vaccine mRNA based, only few can have effect of it. So there are
Yes.
multiple factors affecting it. Okay. You can join us our course, guys, so we can discuss these concepts more in detail.
Absolutely.
Right?
Yes. So, guys, I'm sharing the feedback form again. Whoever is left, please fill the feedback form. And I have also shared this link also to join the course. So as much as possible, if you wish, you can join the course as well if you liked it. And you please fill the feedback form so you can get the certificated lab. Okay. So thank you
Right.
very much, guys. Take care, and thank you, Dr. Neha. Thank you very much.
Thank
See you.
you.
Thank you.